usually by about the middle of the third session, I share with the patient what I have heard. And all of you will have different ways of sharing that with your patients, but and those ways change over time. There's that too, they'll change over time. But I generally say to people that I share with them whatever I've heard about their life history, the struggles they had, the things that were difficult, the things that they were phenomenal at, the successes they've achieved, what has worked for them, what has not worked for them, in terms of relationships, in terms of professional life, in terms of feeling happy or miserable. If they have specific symptoms, I talk about those. And I'm looking for what is the level of suffering, and I can't really judge that always. So I share that with the patient that, there are some patients with whom it's very clear that they need a lot of help. There's been a lot of suffering, and there's still a lot of suffering. With other patients, although there has been a lot of suffering growing up, there may have been traumatic events, the patient is functioning quite well in many ways, has been able to have a relationship, and a good one, but let's say they might be having difficulty professionally, or they have some physical symptoms, or they have anxiety a lot, or they have become depressed. What we are suffering from comes up in different ways. Either it comes up in the, as Freud said, symptoms or inhibitions, and I think there are many other ways it can be exhibited. So with some people it's very clear for me what I would recommend. With others it's not so clear, and I think the more I've been doing this, the more I realize that things are not so clear, and which makes thinking about a recommendation more challenging in some ways. But I will stop here and I'll let you think this over. And if you're interested in learning more, come back and join us for the next 3 seminars of this course, in which you'll get a sense of a live interaction with the patient, and we'll process that material together, and then together we'll think about what each one of us might recommend for that patient, for their treatment. Okay, it's been great talking to you, and I'll see you next time.